While there are no evidence-based treatments specifically for gaming disorder, there are some tried and true types of treatment that help immensely with addictive behavior. Dr. Judith Joseph breaks down those options in this episode. When parents come see a professional for video game addiction for their child, what are some of the treatment options they can expect to hear?
So this is really important. There are no evidence-based treatments. And I know that can be shocking and daunting, but the truth is we need more research in this area. However, some of the things that are being used are tools such as cognitive behavioral therapy. That's something that is readily utilized for anxiety disorders or even for depressive disorders. And for the more severely addicted people, there are specialized inpatient units that have several components. So the person first detoxes completely inpatient. And this can be quite disturbing to watch because they do go through withdrawal. And then gradually they start to learn how to self-care for themselves. There's a great program called Restart out in Seattle where there's really pioneering this area, where they're removing people from the environment where they became addicted and giving them basically their life skills back by teaching them how to cook, how to clean, how to do your day-to-day functions, how to live without gaming. And then the second phase of it is that they take them out into nature. They go on long walks, they do group therapy, they learn how to reconnect with others. Because frankly, when you're gaming online, you're only connecting with people who are gamers. And then the third part of that program is having them re-enter the real world. And this can be tricky because if they return to their environments, then they're tempted to game again.
Right.
So typically people stay within that area so they can be connected to the outpatient services there.
So if they're not severely addicted and they're just going to a therapist who's practicing CBT, and by the way, you can watch our CBT series right here on MedCircle, or they're just practicing basic talk therapy with a therapist, what are the success rates that you're seeing?
So that's also very difficult because there aren't any studies. What we found with addiction is that there's a type of therapy called motivational interviewing that really works with people who struggle with addiction. Why? Because it's non-judgmental, open-ended questions are asked so that the person really has a sense of autonomy and they come up with reasons as to why they're not being successful in life. Why is the addiction causing a problem for them? They're coming up with the triggers, they're coming up with the solutions, and they're the ones who are enacting the resolution. And so those type of therapies tend to help with addiction.
And there's obviously no medication for video game addiction.
There isn't. However, like I mentioned before, a lot of people who develop addiction also become depressed. They also become anxious, right? And there are medications for depression and anxiety that do work.
When they go, or if they go through a withdrawal, are they given any medications to make that an easier time?
Sometimes they are, because withdrawal can look like depression, it can look like anxiety, and there are medications for both.
So the big question every parent wants to know is, when will the treatment start working?
That's dependent on the individual.
Okay, but I'm going to push you for an answer.
Okay.
What about on average in your experience?
I think that treatment works when you're, especially with addiction, when you're fully removed from the environment. And so if you are severely addicted, you've got to be removed. Now, if you are not, and you're, let's say you're still in your home setting and you're coming in for regular sessions, but you still have access, your treatment isn't going to work. It's the same as someone who has trauma and they're coming to the clinic, they're getting CBT and talk therapy for their trauma, but then they're returning back to an abusive home, they're not going to get better.
That makes sense. So if a parent has two kids, one can healthily play video games and the other one is an addict, they are going to have to remove all video games from the house.
They will, and they may have to even remove the internet from the house, because with addiction, people find a way.
You're asking people to remove the internet from their house.
Yeah.
I don't know anybody who would willingly do that. I mean, it would have to be a very compelling reason to remove the internet because we depend on it for everything.
Addiction is serious, and sometimes you have to do drastic things.
Yeah. And could they ever get the internet back?
Well, that's also something that I think is a problem, because how do you escape the internet?
Right.
And so I think that the case varies. I once treated a girl who the mother had to actually lock up the modem, physically lock up the modem. And the one day that she didn't lock it, that this 8-year-old found a way to connect to the internet.
And to game?
Yes.
Wow. So this is a really serious thing.
It is.
People, I know we're towards the end of the series now, but it's worth really driving this home that just because we put a playful word like game in front of addiction doesn't lessen the intensity or severity of the word addiction. That word is there for a reason, because this is a serious condition that requires serious intervention, and this is not a game. Video games may be a game, but video game addiction is not.
Right, and it's important not to throw the word addiction around lightly as well. There is overuse, there's unhealthy habits, but addiction is full-blown withdrawal, tolerance, all the things that you see with drug addiction.
Wow. As a parent, how can they best support their children through this treatment time?
When addiction develops, it is not comfortable. It hurts. And so what I've seen time and time again is blaming the child or the teen. Why can't you be like this person? Why didn't you just listen to us? Don't you see this is ruining your life? Judgmental approaches do not work. People don't like to feel like they're the problem. They'll shut down. And what's worse is that they will self-medicate by further engaging in that behavior. So you've got to be empathic.
Any final thoughts on treatments?
I think more needs to be researched. I think we really need to empower physicians. Right now, I'm in the process of developing a course for physicians at NYU to teach them how to learn more about video game addiction and what to do about it, because frankly, the options aren't out there. We don't know enough, so we really need to research this area more.
Well, I'm happy that our MedCircle members are getting this education, because right now you're getting everything that is out there. And as this develops and as we continue to do more research, and as you continue to do more research, we'll of course update this so that people have the information they need, the education that they require to make good decisions for themselves and their families. So thank you for providing that. In our final episode, we'll talk about what long-term care and post-treatment looks like for video game addiction.